I am Dr. Subrata Saha, done my MBBS from Calcutta Medical College and done my MD in Psychiatry from NRS Medical College. I am practicing as a consultant psychiatrist for last 20 years in Kolkata as well as in Hooghly district. Before going to discuss about the causes and types of depression, I will say a few words when to consult a doctor regarding your depressive elements. When you feel sad or little bit indifferent towards any sort of activities, even pleasurable activities, along with this you have changes in the sleep or appetite and daily activities, then you should consult a doctor, preferably a psychiatrist. Then we come to the causes of depression. Causes of depression we can divide into two segments. Number one is environmental or social segment, social causes, and the second one is biological changes or the changes what will happen in your body or specifically in brain when you are suffering from depression. In the environment or the society, when you have immense pressure or immense stress in some sort of point, you cannot afford that sort of stress, then you may suffer from depression. But still there is some genetic overload or there is some genetic weak susceptibility which will lead to depression, because the same point of pressure may go to another person, but that person will not suffer from depression. So the genetic susceptibility is the most important point than environmental pressure. Then we come to our biological causes. What are the biological causes? Biological causes means what are the changes in your body or the changes in your brain specifically. It has been found that there will be decreased serotonin or decreased norepinephrine, along with that decreased dopamine in the brain that lead to depression. Along with that, there will be decrease of the postsynaptic receptors in the serotonin sites, so that low serotonin level will lead to depression. It has been also found from the research that the low level of serotonin metabolites are there in a patient of depression. Now come to the point of signs and symptoms of depression. According to DSM-4, there are several signs and symptoms, out of which the two are more important. Number one is sadness of mood or indifferent to any pleasurable activities. That is, you cannot feel any pleasure to any sort of pleasurable or any sort of activities which you prefer like before. Along with that, you have several features. You may have some symptoms, that is changes in the appetite, weight loss or maybe weight gain. Along with that, decreased sleep or increased sleep, or there may be agitation or psychomotor retardation. Along with that, you have thoughts of death or what we mention suicidal ideas or suicidal planning or maybe suicide attempt. Along with all the features, you may have some psychotic symptoms, but these symptoms must persist more than 2 weeks. Unless and until it lasts more than 2 weeks, we cannot consider it as a depression. Now, what are the types of depression? The number one is postpartum depression, which we usually miss. After childbirth, lot of mothers suffer from depression, which is undiagnosed. Lot of people think that mother is suffering from some sort of madness, but that is actually postpartum depression. After childbirth, there is hormonal changes which will lead to depression in a mother. So postpartum depression must be treated. And the second one is psychotic depression. That means when the depression is associated with psychotic symptoms. Psychotic symptoms means you have delusions or hallucinations. The last but not the least is dysthymia or the chronic depression. The chronic depression means you are depressed for a long time, at least more than 2 years, but with low severity. That is, you have so much of output, but you have low output due to dysthymia. If you have depression of low severity for more than 2 years, then it will be considered as dysthymia. Another type of depression is there, that is called bipolar depression. That means bipolar means there are two poles. One pole is mania or hypomania, that is increased activity, and another pole is the opposite one, that is depression or the low activity along with sadness. So if you are having bipolar depression, that needs to be treated, because it has been found in patients of bipolar depression, specifically bipolar 2, lot of patients committed suicide in bipolar 2. So what I have mentioned, all the types of depression. Another point I should mention, that is seasonal depression. That is, in winter season, because of less sunlight, lot of people suffer from depression. This seasonal depression specifically occurs in winter season. And what are the treatment of this seasonal depression? Seasonal depression very commonly responds to SSRI, that is sertraline, and another biological therapy is there, that is phototherapy. You have to expose to a strong light after evening, so that you will be exposed to strong light, and this strong light or phototherapy will give you relief from seasonal depression. If you have any queries regarding depressive illness, you may contact me or may click on the link given below. Thank you for watching me for a long time.